Guys, welcome back to Medical Coding with Blue. Okay, this video is going to be in response to one of the questions that I got from a viewer. She wanted to know what are some of the basic things that you have to know as a medical coder. She was concerned because she felt like the school that she had gone through or the program that she had gone through was just showing her how to pass the exam, the medical coding exam, and not really what is medical coding all about. And I've heard that complaint quite a few times. There are a lot of people that complain about that they were only taught to pass the exam, not really like the meat and potatoes of what goes on with medical coding. So I'm just going to give you just some basic pointers of what it involves, what it takes. Obviously, it's going to take a lot of study. It is not something that you learn overnight. It is certainly not something that you're going to learn in a very short course. I always recommend taking as long of a time as you can to learn it, because not only when you take your exam and you pass this exam, you still have to go out into the real world. You still have to apply at whatever facilities you're going to, or doctor's offices or companies that you're trying to get in with, and you still have to apply with them. You still have to pass their proficiency exam. So if you're just passing a certification exam and you're not able to pass the proficiency exams, you're in trouble, okay? It's going to take a lot of knowing how to navigate the book, okay? Not just the diagnosis book, the ICD-10 book, but the CPT or procedure book as well, okay? You have to know how to navigate those two. Those are the two hugest things. You have to know anatomy, physiology, medical terminology. These things are very key. Those are the foundation. That is your foundation right there. You also have to have really good reading comprehension. Now, I say this because if you are not a reader, this is a problem. This is all what medical coding is, pretty much, is reading. You're reading encounters, you're reading charts, you're reading surgery notes all day long. If you are one of the persons that wants to stretch yourself, of course, you're going to be doing a lot of other activities during the day as a medical coder, but that is a majority of what you're doing all day. Reading comprehension is really key to this whole thing as well. If you don't understand what you're reading, this is a problem, because you have to be able to interpret what you're reading so that you can turn it into a medical code. If English is not your first language, this is going to be a hard time as well. It's not easy for people who English is not their first language. I have seen it many times. I'm not trying to be insulting. Okay, so you can be insulted if you want to, but I'm not trying to be insulting. I'm trying to tell the truth. There is a difference between like cardiac lead and lead poisoning. I've seen those get confused when the person doesn't speak English is not their first language. So it's hard for them to interpret that as well. So if, like I said, if English is not your first language, it might be harder for you, because you still have to be able to interpret this document. You have to be able to interpret this information that's coming at you. It's not all about just, oh, they did a laparoscopic appendectomy, and that's the code that I'm picking up. Well, did you know, if you're reading that that the provider may title it laparoscopic appendectomy, but as you're reading and going through the documentation, they had to convert it to open. So these are the things that you have to be able to look through the documentation. You have to be able to decipher out the things that's going on, and you have to be able to interpret that into a medical code. So this is where a lot of studying and applying yourself with reading is really, really going to help you. Also, being patient with yourself is really key. It does get to be a lot sometimes. I'm not gonna lie, it is a lot. You have to look at this information that's coming at you. You have to be able to understand what it is that you're reading, even though you've never been to medical school. The vast majority of us as medical coders has never been to medical school. There's a very small percentage of medical coders that are actually doctors that have been to medical school. So it's easier for them. At least I think that it's easier for them, because they really do understand. Sometimes when I'm going through a record, I have to actually stop and read and look up what the procedure means, what they're doing. Does this condition resolve? Is this a chronic condition? Is this any questions that I may have? What symptoms are involved with this diagnosis? What sort of procedures are they going to do here? If they have this condition, are they going to be able to do this? So there's all these questions that you have to ask yourself. Medical coding is a lot of fun. If you are a reader, if you like to study, I say this all the time, and I'm very biased when it comes to this because I really love what I do. There's really, once you have those things, it did take me over 10 years to amass as much knowledge as I have now, because every year that you're in it, or the longer that you're in it, the more knowledge that you're able to gain. Although sometimes if you're not trying, or if you're not stretching yourself, your knowledge base is going to stay the same. The more you stretch yourself, the better off you'll be. I tend to go 100 whenever I do anything. And that means researching anything and everything I can get my hands on. I continue to read the New England Journal of Medicine. I subscribe to the New England Journal of Medicine because I think it's really important. These are the magazines and things that are put out by doctors. They write these articles and they talk about these conditions. And while some of the stuff is going over my head, I still read it anyway, because eventually it's going to make sense, because I'm still immersing myself in the culture of medicine and what goes on. What medications do they look at when they're treating this patient who has this particular condition or disease or disorder? And this has really helped me. Sometimes I'm sitting there and I'm listening to the surgeons when they're speaking, and I actually now understand what's going on. Because why? I read my New England Journal of Medicine. I read the Journal of AHIMA because I am a member of the American Health Information Management Association, and there's a lot of good information that goes out into those journals that go out. And I get them, like I said, because I'm a subscriber to my association, and they send them out, and I take the time and I read them, and even though if some of it has nothing to do with me, I still continue to read. So these are just some of the basic things that you have to know as a medical coder. Really good communication skills is very important, even if you are a shy person. I started out as a really shy person, not really thinking that anybody wanted to know anything that I had to say, until I started having to communicate. It was literally not a choice. I had to communicate with my providers, and I had gotten a complaint one day, and I've told the story many times. I got a complaint from one of my most favorite, he is my most favorite, Dr. X. And I didn't know at the time that he wanted more communication from me, but as it turns out, when I got this complaint from the one of the administrators at the hospital, I went and talked to him about it, and I said, what's going on? What are you looking for? And he's like, I just want more communication, because you do talk to me, but it's not a lot. So this is where talking to each other and getting to, maybe if they need assistance with something or things like that, this is very important. Whenever I see a coder that doesn't talk with their providers, it bothers me, because especially if that is part of their job. If part of their job is to talk, because I understand that sometimes in certain facilities, the coders are not always allowed to talk to the providers, but in other facilities it is. In my facility in particular, we are able to talk to the providers. So but in my years of being a medical coder, I've seen coders literally say, I'm not talking to this provider. I'm not talking to providers at all, period, because they don't want to deal with them. And that's not fair. It's not fair to the provider. It's not fair to the documentation and making sure that everything's there like it's supposed to be. Because if you're actually just going through and just looking at the documentation and not asking questions when you should be asking questions, this is a problem. So again, these are just some of the things that you have to have: really good communication skills, good reading comprehension, knowing your anatomy, physiology, and your medical terminology, and knowing how to navigate the ICD-10 book and the CPT book. Those are the things that you need to know. That is your base foundation right there. All the other extra stuff, as far as like reading and taking workshops. That also helps as well. Sometimes people will complain that it's a lot of money to do workshops or to attend workshops, or even to go to conference. Yes, it is a lot of money, and I say this every year. It is a lot of money to go to conference. It is not just like $1,000. It is a couple $1,000s that you have to spend, but there are ways to save, and there are ways to make sure that you are investing in yourself so that you can get further ahead. I think because I started going to conference in 2014, I think since then my passion for the field has grown. I know a lot more now because every year when I attend conference, it really does help. I start to learn more and I start to expand more. And it's not just about the coding part. It is about being the entire package when it comes down to being a medical coder. It is improving my communication skills. It's improving my leadership skills. Because even though I don't technically have the title of a leader, I'm not even a supervisor, doesn't matter. You can still have that good energy and be able to have people respect you because you know what you're talking about and you know how to effectively communicate. That's very important. I've taken the time as well to attend other seminars that are not even about medical coding. It's about public speaking and making sure that when I am giving a class, the message is coming across very effective and it is being received well. So again, those are just some of the things that you do have to know. But these things take time. It's not going to happen overnight. And if you aren't strong in certain things, it's okay. Just take your time with it. Just make sure that you're reading. Going over the guidelines is really key as well, especially when you're learning to navigate the book. Because if you went through a very fast program and you did not get all of the teaching that you feel like the hands-on stuff, I'm glad you're here. This means that you are interested in learning more about medical coding, because I've lived a lot of it for over a decade. And it's not just 10 years, okay? Somebody got smart the other day and said, oh, you only have 10 years. No. I said over a decade. So it is over a decade that I've been in this industry. And I've learned a lot in that time. And I'm going to continue to learn more. So, and I hope that sharing it with all of you gets to help somebody out there, because that's ultimately why I do these videos. I do these videos to help people. And I've said it in another video because, sometimes I think sometimes it's like people just don't get it, and they're just like, well, and it takes a lot. It does take a lot. And doing the exercises takes a lot. Coming up with topics takes a lot. Making sure that I give you guys enough information takes a lot. It takes a lot of time, takes a lot of energy, and I want to make sure that it comes across correctly. So, but yeah, that's all I had on that topic. But yes, if you are starting out and if you're just feeling overwhelmed, don't. It's going to come, but it'll take time. And just be patient and stick with it, because consistency is key. Being consistent is always going to be key. Okay, so I'm going to go ahead and wrap this one up. I'm going to do one more video today for my YouTube channel. And then I'm going to be working on my videos for my Patreon channel. Again, those videos are going to be exclusive to Patreon. They will not be shared here. Okay, but my next one is going to be about my favorite books. Somebody was asking me about what my favorite books are, so I'm going to be doing that video as well today. So I will be around this weekend, so if you guys have any questions, email me, let me know, and I will see y'all on the next video. Bye!